So, good afternoon. My name is Noraline Gutierrez, and for today, I will be presenting the three common mental health conditions, and these are depression, bipolar, and anxiety. So, napili kong i-discuss ito ngayon dahil I'm experiencing the same issues. So, let's start. So, depression, bipolar, and anxiety. You probably heard these terms before, but how much do you know about these mental health conditions and how much do you know how they affect people? So, understanding these conditions can help reduce fear and misunderstanding of mental illness and empower everyone with the knowledge of on how to take care of their mental health and the mental health of their loved ones. So, I have compiled these resources using online materials shared by professional and expert groups. So the resources on this page or on this PowerPoint presentation are meant to be educational and should not be taken as medical advice. So if you suspect that you are having a mental health concern, please seek help from the professionals before taking any actions. So let's start with anxiety. So anxiety is a common emotion when dealing with daily stresses and problems, but when these emotions are persistent, excessive, irrational, and affect a person's ability to function, anxiety becomes a disorder. So there are different types of anxiety disorders, including phobias, panic and stress disorders, and the obsessive compulsive disorder. So we are familiar with phobias, panic, and stress disorders, and uh, we are not familiar with obsessive compulsive disorder or yung tinatawag nilang OCD. So, itong obsessive compulsive disorder, ito yung disorder in which people have recurring unwanted thoughts, ideas, or sensations, or yung tinatawag nilang obsessions that make them feel driven to do something repeatedly, or yung tinatawag nilang compulsions. So, the symptoms are apprehension or yung lagi silang nag-worry. And confusion. Confusion is a situation in which people do not understand what is happening and what they should do or someone or something is. So, number 3 is a sense of helplessness, repeated negative thoughts, muscle tension, palpitations, difficulty in breathing. So, itong anxiety na to. So, bali nagkaroon ako ng depression and anxiety. So, ito yung mas worst or what I think is ito yung pinaka-worst na na-experience ko yung anxiety. Dahil talagang nagpa-breakdown ako, nakuha pa akong isubod sa hospital dahil sa palpitations ko at nahihirapan akong huminga. So, nung nasa hospital na ako, normal lahat. Normal lahat ng vital stats. Normal yung tibok ng puso ko dahil may ECG ako. So, talagang kinailangan nila akong i-refer sa neurologist. Dahil yung neurologist talaga yung makakatulong sa akin. So, next is treatment and health. So, simple strategies such as relaxation techniques and regular exercise are effective in reducing anxiety and contributing to emotional well-being. So, psychotherapy can help and is sometimes used together with medication to reduce and eliminate signs and symptoms. So, ayun nga, yung psychotherapy is a general term for treating mental health problems. By talking to a psychiatrist, psychologist, or other mental health provider. So during psychotherapy, you learn about your conditions and your moods, feelings, and behaviors. So next is bipolar disorder. So bipolar disorder, formerly referred to as manic depressive illness or yung tinatawag nilang manic depression. So is a mood disorder with two extremes: depressed, low, and manic high. It varies in severity and mild cases may appear ordinary for many years. symptoms vary. A person may be predominantly depressed or predominantly manic. In between episodes, a person is likely to be quite well and able to function. So, itong bipolar disorder, kumbaga mas okay siya kaysa dun sa anxiety disorder dahil kapag may bipolar disorder ka, pag sinabi natin bipolar disorder, ito yung mga taong nagkakaroon ng mood swing. So, parang ngayon okay siya, tapos maya-maya mainit yung ulo niya. So, hindi mo siya hindi mo makuha yung ugali ng taong may bipolar disorder. So, ang symptoms niya is depressed, persistently sad, hopeless, and lethargic, feel suicidal. So, among other symptoms, when manic, a person becomes overelated or irritable, requires less sleep, make grand plans, and may impulsively engage in potentially dangerous behavior. So, kapag may manic depression ka, katulad nga ng sinabi ko, ngayon okay ka, tapos maya-maya, mainit yung ulo mo. So, yung behavior mo, kung hindi ka magagamot, magiging worse. So, kung meron kayong argument ng isang member sa family nyo o kung married ka, may tendency makasakit ka physically. So, treatment and health, psychotherapy can help people who are most stable to help them with symptom recognition and management. Medication can be used to treat acute episodes and to help prevent a relapse. So, psychosocial support is an important component of treatment. So, let's proceed with depression. So, depression is a long mood that lasts for a long time, affecting everyday life. So, it is often triggered by a mix of genetic, psychological, and environmental factors. Study shows that the risk of becoming depressed can be increased by life events such as poverty, death of loved one, physical illness or abuse. For some, the risk is also hereditary. So, hindi lang yung mga taong nakaranas ng mga abuso or nakaranas ng bad experiences sa buhay yung nagkakaroon ng depression. Actually, ako, naranasan ko tong depression na to after kong mga anak. So, nagtataka din ako dahil sa panganay ko, hindi naman nangyari sa akin to. Dito lang talaga sa second born son ko. So, ayun nga, dumating sa point na nakakapanakit na rin ako. So, umiiyak ako ng walang dahilan. Parang napakababaw ng luha ko. Parang, hindi lang, nagpapakuha ako ng tubig, hindi lang ako narinig. So, parang, ang sama ng loob ko, feeling ko napaka-worthless ko. Tapos, nagkaroon din ako ng suicidal thoughts. So, itong depression na to, based sa experience ko, kailangan mo rin tulungan yung sarili mo. Kasi walang ibang makakatulong sa'yo pag nakakaranas ka ng depression mo. Feeling ko walang ibang makakatulong sa'yo kundi yung sarili mo. So yung mga mental health experts na yan, kumbaga, guide lang sila sa mga anong dapat mong gawin. Pero kailangan mo rin tulungan ng sarili mo. So symptoms, persistent sadness, loss of interest in activities, loss of appetite, feeling of worthlessness, and becoming easily agitated. So, treatment and health, talk therapy with a trained counselor or psychotherapist, exercise and support groups are among the options available. So, antidepressants are also sometimes prescribed, but they should not be used for treating children and should not be the first line of treatment for adolescents. So, all treatment should involve identifying stress factors and sources of support, and individuals should maintain social networks and activities. So, based sa experience ko, so nung nagpa-consult nga ako sa isang mental health provider, so naituro niya sa akin yung mga dapat gawin. So, nag-session kami, nag-talking therapy session kami, pero itong talking therapy session na to, hindi siya masyadong nakatulong sa akin dahil kapag na nagsishare ako, feeling ko bumabalik-balik sa isip ko. Instead, nakalimutan ko na lang yung mga nangyayari sa akin. Parang ulit-ulit na bumabalik sa isip ko. So, ang pinaka nakatulong talaga sa akin dito is yung pag-exercise. Dahil nga kapag nag-exercise ka, naglalabas yung body mo ng happy hormone. And take note, kapag may day na hindi ako nakakapag-exercise, napapansin ko medyo sinusumpong ako. Nararamdaman ko na naman na medyo bumibigat na naman yung pakiramdam ko na parang nalulungkot na naman ako ng walang dahilan. Kaya malaking tulong talaga yung exercise kahit 15 or 30 minutes a day. So, ayan. So, dito na natatapos ang aking presentation about the 3 common mental health conditions. So, be kind for everyone you meet is fighting a battle. So, sabi nga nila, be kind to your mind. So, my last message is, before I end this presentation is, for anyone who is experiencing similar to what I'm experiencing right now, you may look around and think that no one else in this world understands what you are going through, what we are going through, but there are people who do. So never be scared or feel ashamed of what you are going through. So whatever you're feeling or suffering from now, it will get better. So with God's help, you'll get through this. We will get through this. And that's all for today. Thank you for listening. Goodbye.